This story from December 2006 warned about serious patient injuries from injecting promethazine intravenously, and it gave several ways to minimize the risk. The Institute for Safe Medication Practices recently warned that administering promethazine parenterally can cause more severe tissue injuries than previously recognized. Promethazine, which is commonly sold under the trade name Phenergan, has many uses, including as an antihistamine, a sedative, and an antiemetic.
ISMP points out that promethazine is a known vesicant, which is highly caustic to the intima of blood vessels and surrounding tissue. Deep intramuscular injection into a large muscle is the preferred parenteral route of administration, and it's least likely to cause damage. But promethazine is also given by slow IV push in many hospitals. It's this IV route, along with inadvertent intraarterial or subcutaneous administration, that's most likely to result in significant complications, ranging from burning and pain to paralysis, tissue necrosis, and gangrene. Sometimes surgical intervention, such as fasciotomy, skin graft, or even amputation, is needed.
ISMP describes several recent cases where severe tissue damage occurred following IV administration of promethazine. For example, in one case, a 19-year-old woman who went to the emergency department with flu-like symptoms was given Phenergan IV. During the injection, she cried out in pain, and after the injection, she told the nurse that her arm was still in significant pain and that she felt something was wrong. The nurse reassured her and then left the room. The patient's arm and fingers became purple and blotchy, and then over the next several weeks eventually turned black and shriveled. Her thumb, index finger, and top of her middle finger eventually had to be amputated.
ISMP points out that the product labeling makes several recommendations to reduce the risk of these adverse events. They include giving the drug in concentrations no greater than 25 milligrams per milliliter, administering the drug at a rate no greater than 25 milligrams per minute, injecting the drug through the tubing of an infusion set that's running and known to be working satisfactorily, and stopping the injection immediately if the patient reports burning in order to find out whether there might be intraarterial placement or perivascular extravasation.
In addition to the manufacturer's recommendations, ISMP lists about a dozen other strategies to prevent or minimize tissue damage when giving IV promethazine. Here are just a few of them. Stock promethazine only in the 25 milligram per milliliter concentration, since this is the highest concentration of promethazine that can be given IV. Consider 6.25 to 12.5 milligrams of promethazine as the starting IV dose, especially for elderly patients. Give the medication only through a large bore vein and check the patency of the access site before administering. Administer IV promethazine through a running IV line at the port furthest from the patient's vein. Consider administering IV promethazine over 10 to 15 minutes. And finally, before administering the drug, tell patients to let you know immediately if burning or pain occurs during or after the injection.